Some good news for British Columbians struggling with prescription drug costs. BC is expanding Pharmacare coverage to include certain medications used to treat type 2 diabetes, heart failure, and even blood clots. Dr. Tom Elliott is the medical director for BC Diabetes and is joining us now. Thanks for your time today.
Good morning, Sonia.
All right. Now, we understand that this is something that doctors had been advocating for some time, in particular to the drug called Ozempic. Give us an understanding of how significant this change is.
So, Sonia, doctors have been able to prescribe Ozempic and another class of drug called the SGLT2 inhibitors. But there was a lot of red tape around getting approval so that Pharmacare would cover the drugs. That red tape has been reduced. It hasn't been completely removed. So really, and I think the red tape was enough to discourage doctors from prescribing it at all. So it's very good news for British Columbians, 400,000 type 2 diabetics, particularly if they're overweight. The Ozempic and the other class of drugs lower sugar, which is what you want in diabetes, but they also lower weight. And overweight is a common problem, and overweight worsens diabetes control. Historically, the drugs we had increased weight. So now we've got easier access to drugs that lower weight and do it safely and improve the overall situation with diabetes.
All right. Now, you mentioned that this has only reduced the amount of red tape that doctors would have to go through in order to prescribe Ozempic. So is it a positive step, or is there still too much red tape? Would you have liked to have seen something else?
Well, I've learned to expect improvements incrementally, Sonia. So I'm absolutely delighted about it. And believe me, my job in advocacy is to improve the lives of my patients and the remainder of BC people with diabetes. So yeah, it's big news, and it'll make it much easier for family doctors who don't have to print off these forms, fill them in manually. We have some automation, but so it's very good news generally. The other obstacle that people still face is the expense of these drugs, and the fact that the BC Pharmacare deductible is set high, so that about 70% of British Columbians will never actually reach their deductible. So, one of my other avenues for advocacy is going to be ideally removing the deductible completely, and if not, reducing it so that at least 50% of the province can get discounts on drugs and devices for diabetes.
So how much is this going to cost British Columbians, now with this change in place?
Well, the cost hasn't changed. So Ozempic, which is the number one drug for diabetes for people with overweight, it costs $7 a day. So it won't be any cheaper. It's just that the red tape preventing patients filling the prescription and putting that cost towards their deductible, that has been reduced. So it is still big news. And for those listening and saying, I can't afford $7. Well, it's interesting that half the usual dose actually gives about 80% of the benefit. So we have a lot of people on half dose, so $3.50 a day, that are getting a great deal of benefit as well.
All right. So, going forward, you mentioned you like to see things happen in increments. So what would be the next step that you would like to see?
Well, I don't want to be greedy, but Minister Dix, if you're listening, I'd like to raise the ceiling for zero deductible from its current pathetic $13,725 up to $50,000. That would be huge. And I would accept incrementally, a lesser number than 50,000. And then I'd like to see the deductible currently calculated annually. I'd like to see it done monthly by default. Currently, you can apply for a monthly deductible. See, let's say a family has a deductible of $3,000, so $250 a month. Currently, you have to spend $3,000 before you get a cent back. If you have a monthly deductible, once you've spent $250 in a month, you would get money back. So the average person with diabetes is spending $10 to $12. So, let's say 350. So even in January, they'd have $120 in their pocket. So I'd like to see the monthly deductible become routine.
Got it. Now, when it comes to the overall picture, what is this going to mean for the health of British Columbians, and especially for those obviously with type 2 diabetes, now that they would have better access to this drug?
Well, it's going to mean that more of the 400,000, I don't know what proportion are on it. You know, in my clinic, we've got 1,500 people on Ozempic. So it's going to mean more people are on the drug, more people are going to benefit from the improved sugar control, the sustainable weight loss, and the reduction in cardiovascular risk, a reduction in heart attack, stroke, and death, as well as improvements in kidney disease. There's a pill drug, Sonia, called Jardiance, and another one called Forxiga, which also lower weight, lower sugar, and reduce cardiovascular kidney complications. So that was also the red tape was reduced for those two drugs. So all around, it's very good news. And if you're listening to this newscast this morning and you've got type 2 diabetes, you're overweight, and you're not on these drugs, I do recommend you speak to your family doctor.
All right. Good advice. Dr. Tom Elliott joining us from the BC Diabetes. Thanks very much for your time.
Thanks a lot, Sonia.